Thank you.
Well, thank you so much. And my colleague, Dr. Krista Capehart, as you can see here, she will hopefully be joining us. She works with, she's the pharmacy lead for the West Virginia State Joint Interagency Task Force. She also works for the Board of Pharmacy, and so she's working on a legislative rule as we speak. So the goal is that she's going to be able to join us as well. But until she does, I am going to kind of lead the talk. And as you can see here, I also want to say thank you to Dr. Julia Frostino. She leads the Joint Information Center within the West Virginia Joint Interagency Task Force. And so as these Project Echoes have kind of become pop-up sessions, there's been a lot of information in the past few weeks, this month in September, in that there was a new COVID-19 Omicron bivalent booster shot authorized for use. And so we are seeing these make their way more into our communities. And so we thought this would be a good time to give an update. A lot of this content is available. As Mitra said, I am with my 7-month-old, so I apologize. She might chime in on some of these. We'll see if she has some exciting feelings about vaccines. I think her first word is going to be COVID-19 vaccines are safe and effective, or safe and effective at least, because that's what she's heard a great deal of. So we'll go ahead and advance to the next slide. And thank you. So as I mentioned, there's 2 products authorized as emergency use as boosters only. And so both of these products made it through their typical path in which the FDA has to first authorize. They did that through amending their authorizations. And I think Dr. Capehart's joining us now, so I'll quickly transition to her. But you can see here that after the FDA authorized these products, and then it went through the Advisory Committee on Immunization Practices, and CDC subsequently recommended the Pfizer-BioNTech COVID-19 bivalent, which you will hear us, and we'll talk a little bit about this, referring to it in plain language as the Omicron booster shot. And that is a booster only for 12 and older. And then the FDA did the same for the Moderna bivalent product for 18 years and older. So these are the 2 products that we have that also cover the original strain of the virus, and then also BA4, BA5 of the Omicron strain that we've seen. So Dr. Capehart, I talked about you so wonderfully before you joined, because Dr. Capehart does so much for our state, and I am not exaggerating when I say our COVID vaccine program would be nowhere without Dr. Capehart. She is the person doing a lot of behind the scenes work to ensure that we get these products in our state and that we educate those who are administering it, as well as educating the public. So if you're ready to go, Dr. Capehart, I'll turn the next slides over to you, as we just started talking about the 2 products that are now authorized.
Yes, absolutely. And I apologize. I am running from the legislature and back, but thanks so much for having me today. So we just got these bivalents authorized. Pretty exciting, I think, just because this is going to give us a new option, and really something that is going to be able to tackle what we're seeing now. So these updated boosters, or COVID bivalent boosters, have both the original strain of SARS-CoV-2 and the Omicron BA4 and 5 subvariants in them. So essentially, this is going to help to where our immune systems have waned. This is from that previous vaccination. This is really going to target that Omicron variant that is prevalent right here and right now. And the studies that were done really showed that as we looked at neutralizing antibodies, that these boosters really boosted those neutralizing antibodies to essentially all of the forms, but especially in those Omicron BA4 and 5s. So very excited. I think this is a great new tool in our toolbox. And it's also important to recognize that while this is bivalent and has both the original strain and BA4 and BA5, it doesn't have anything to do with the flu. There's a lot of misconceptions out there because it does have, we're talking about it having 2 strains, that it's somehow connected with the flu. And so this one is just going to protect you from COVID. So if we can go ahead, next slide. So looking here, this new EUA replaces the previous EUA for boosters ages 12 and older. Now, we do anticipate that the younger ages will switch over sometime in the coming weeks to the bivalent booster. I don't have an exact time frame, but we are anticipating ages 5 and up, probably sometime around early October. The original monovalent messenger RNA COVID-19 boosters are no longer authorized for boosters for ages 12 and older. So if you do need to use and administer a booster ages 12 and older, so 12 to 17, you would need to give the Pfizer product, and 18 and older, you could give either Pfizer or Moderna. So these are only the bivalent boosters are only allowed to be used, are the only boosters allowed to be able to be used. Now, we do use the original monovalent as the primary series for ages 6 months and up. Next slide, please. So I want to talk a little bit about some terminology. You will hear the media talk about them as Omicron boosters, bivalent, updated, fall boosters. It's really important to recognize that the boxes, the vial, the EUA, all talk about them as bivalent. It is labeled as bivalent, and we'll show you here the labeling on these, particularly Pfizer. They are almost identical to the monovalent version, okay? But I will tell you, in many of the studies that have been done, particularly by Dr. Faustino's group at the Joint Information Center, the public does not recognize the words bivalent or monovalent. As a matter of fact, it's kind of, they're put off by it. So whenever we're talking to our patients, we want to make sure that we're using much more common language like Omicron, updated, and referring to the monovalent as original, and that bivalent as Omicron and updated when we're talking about making sure that our patients get these new boosters. Next slide. So what do we know about who should be getting these bivalent boosters? Next slide, please. So everyone ages 12 and older is recommended to receive 1 age-appropriate bivalent messenger RNA booster dose at least two months after completing the primary series of an authorized or approved COVID-19 vaccine or their last monovalent booster. So I think the important thing here to remember is that we're no longer counting boosters. We're basically doing a reset. So you cannot get a bivalent booster without first completing at least the primary series. So you have to get an age-appropriate Pfizer, Moderna, Novavax, or J&J Janssen. You've got to complete one of those primary series. Then for your booster, it can be the same as the type you got for your primary series, or it can be different. So homologous, the same, heterologous, different. There is no preference. At this time, we've had no changes in the schedules for ages 6 months through 11 years. We may see that in the coming weeks. The time frame that we're hearing for ages 5 and up is probably 5 to 11 years is probably going to be in the coming weeks, but we anticipate the under 5-year-olds is probably not going to be until after the first of the year, just to kind of give you a time frame. All right, next slide, please. So I mentioned that fall booster reset, and we've all been trying to keep up with, is this your 3rd shot or your 2nd booster or your 1st booster, or are you on shot number 5? We're basically doing a reset. We are no longer counting doses. Essentially from this point, everyone is eligible in this 12 and up for a 1 bivalent booster for all that are eligible. So the 12 and up age group. And this is basically how you look at it. You're not going to deny somebody based on the total number of doses. So if they've had a primary series, it's been at least 2 months, you can give them a bivalent booster. If they've had a primary series and 1 booster, wait at least 2 months, give them a bivalent booster. If they've had a primary series and 2 boosters, wait at least 2 months, give them a bivalent booster. Now, remember, people's primary series may have looked different, whether they got J&J, whether they got Novavax, whether they got Moderna, Pfizer, and also whether they were are considered immunocompromised or not. So, when you take all of those things into consideration, remember what their primary series was. Did they complete it? And then you're basically waiting 2 months, and then they're eligible for their bivalent booster. Next slide, please. So let's talk a little bit about the Pfizer BioNTech Omicron bivalent booster for ages 12 and up. So here's something that I really want to stress. These 2 products are packaged virtually identically. So on the left, you have the monovalent product. On the right, you have bivalent. They are for ages 12 and up. They both contain a gray cap. The dose is for the bivalent product. It's a 30 microgram. It has 15 micrograms of the original strain, the original variant, and then you have 15 micrograms of BA4, BA5. The volume is 0.3, does not require dilution, and thank goodness, at least we kept storage the same as this previous gray cap product. So it goes in an ultra cold freezer until expiration, which is 12 months from manufacture, then manufacture date. Then you can move it. You can move it to the refrigerator. Remember, this cannot go in a regular freezer. So ultra cold, or and then you can move it to a refrigerator where it's good for up to 10 weeks. So next slide. This is the part I want you to take and pay very, very close attention to. On the left is your monovalent label. Notice it says Pfizer BioNTech COVID-19 vaccine, ages 12 and older. On your right is the bivalent label. It is virtually identical. The only difference is that little tiny word bivalent and original and Omicron BA4-5. And these are tiny vials, so you're going to have to be paying very, very close attention as you draw these doses to administer, because the Pfizer BioNTech is very, very close. So on the left, monovalent for primary series. On the right, bivalent for booster doses ages 12 and older. Next slide, please. Now we're going to talk about Moderna. It is the Omicron bivalent booster for ages 18 and up. So now we have a few more products, of course. So you have a monovalent product, which can still be used for your primary series, 12 and up, has a red cap, light blue label. You also have a monovalent product that is 6 to 11 years, and it then also is for that 6 to 11 age group for primary doses. Then you have your bivalent product, and this has a dark blue cap, a gray label. It is 50 microgram dose and 0.5 mLs is what you're drawing up. 25 micrograms of original, 25 micrograms of BA4, BA5. Again, they kept all the storage beyond use dates, all that stuff, the same as the other Moderna products. Regular freezer until expiration date, goes in the refrigerator for up to 30 days. So you can use it for 12 hours from the time you puncture the vial to begin drawing out those doses. Next slide, please. So one thing I want to make sure that you are seeing here is it's important to realize that you do have some different labeling going on, because there are products out there that are still labeled for booster doses. That's that previous product that's being used in those 6 to 11, but we're only in ages 18 and up able to use these bivalent product. They have that dark blue cap, gray label, and it is a 0.5 ml Moderna dose. Okay, next slide, please. Let's take a look here at the labels. So on the left, you have your monovalent label. Moderna did a little bit better. There's actually some coloring differences. On the left, you have your monovalent primary series, ages 12 and up. On the right, your bivalent, which is, of course, booster doses only. And this is your bivalent BA4 and 5. Next slide, please. Here's the one that I was talking about with your monovalent versus your bivalent. This is this product, and the next slide should show you how the label is. This monovalent product is the one that the original labeling still is labeled as booster doses. So if you have any of this product, be very careful, because, and remember that 6 to 11 year product is only for primary series, and in your 18 to and older, you need to be using that bivalent product. If you can go to the next slide. You can see here, this is this monovalent product that I was talking about. It is only for primary series age 6 to 11, even though the label says booster doses only. You're not going to use that product for booster doses. It's for primary series only, ages 6 to 11. On the right-hand side of the screen is a bivalent label booster doses only that is authorized for 18 years and older. And you'll see it does say bivalent, original and Omicron, BA4 or BA5, and it is booster doses only. So despite that label, don't use that for booster doses on the left-hand side, because that's a monovalent product. And it was simply because that product had dual authorizations under the EUA on the left-hand side. Next slide, please. All right, so now we've gotten to the point where I'm going to hand it over to Dr. Costello, and she's going to tell you more about the clinical considerations that have come out here recently with these new bivalents.
Well, thank you so much, Dr. Capehart. If you can hear me, and if you can see, I do have my daughter, so I apologize in advance if she gets a little excited. She gets as excited as I do when we get to talk about COVID-19 vaccination. So if you go to the next slide, as Dr. Capehart said, we appreciate, sorry, it's not advanced. Can you hear me okay? Yep, there we go. So here is the summary that is available at CDC, and certainly recommend individuals always going to the clinical considerations. But here is for what Dr. Capehart was saying, the difference between, if you're immunocompromised or not immunocompromised. So this is a list to help show, what is the primary series for what age for people who are not moderately to severely immunocompromised. And then it goes in and you can see where it says bivalent booster versus monovalent booster. And so those, again, as Dr. Capehart said, 12 and older, you can see there, Moderna, Novavax, or Pfizer, BioNTech, 2-dose primary series, and then in 2 months get the bivalent. And then for 18 and older who have had Janssen, primary series, and then 2 months later, bivalent booster. I think where it gets a little bit tricky is, Pfizer is the only product authorized for that 12 to 17-year-old, again, which is what we saw earlier in the pandemic. But I think that's what, it's an additional nuance that can sometimes make this complicated. If you go to the next slide, this is the summary of COVID-19 vaccination for those who are considered to be immunocompromised. So their primary series is a little bit different in that they need additional dose to constitute that primary series based upon their age. And then you can see down below the consideration for Evusheld, which we'll talk a little bit about in regards to ages 12 and older, in regards to when they get their vaccine, 2 weeks later giving Evusheld every 6 months, and then having that time where no minimal interval for the Evusheld to the COVID-19, but then waiting at least 2 weeks from when you have that vaccine to then receive Evusheld. And so if we go to the next slide, you can see here a little bit of that discussion about Evusheld, which is available for people ages 12 and older who weigh at least 40 kilograms. And then you can see here where that's recommended. And Dr. Capehart certainly can talk more about Evusheld and its availability in our state. But this is something that certainly the CDC made note of this time and is, again, another tool in our toolbox, particularly for those individuals who are considered to be moderately to severely immunocompromised. So if we go to the next slide, I think it really important, as Dr. Capehart said, these vaccines are for COVID. I think there's been a lot of discussion in the media that there are other combination vaccines for fall respiratory viruses being studied in clinical trials. They, however, have not yet been authorized or approved for use. So it is recommended to get all age-appropriate doses of vaccines simultaneously as a CDC best practice. I can personally speak. My daughter got her 6-month vaccines for her routine, and she also got her COVID-19 vaccine a month ago. She's getting her second dose tomorrow of her COVID-19 vaccine, and then she'll get her flu shot once they're available as well. And so as we enter into this flu season, I think it's important to be offering that influenza and COVID-19 vaccines at the same visit for those eligible. There are additional considerations for those who have monkeypox vaccine, in that you could delay the period of time for getting that vaccine, but it recommends to take into consideration that person's risk factor. So if they're severely to moderately immunocompromised, that's one of those things in which you would likely have a discussion with a healthcare provider about to consider giving at the same time. There's been a lot of discussion about current prior SARS-CoV-2 infection. So this is, in the CDC clinical guidance. I think this is where it gets pretty nuanced, and there's been a lot of questions about this. You can still give any COVID-19 vaccine until that acute illness has subsided. And so once the isolation period is done, they can be vaccinated. This is more so to protect the person giving the vaccine. However, this round, they did say people who recently had SARS-CoV-2, you may consider delaying vaccination by 3 months, but you need to consider those individual factors and risks. This is not a should recommendation, it's a may consider that. And I think that those are probably discussions that people are going to be having with their healthcare provider. I think we really want to try to avoid a situation in which people come in and then we deny them vaccine. Unfortunately, we've heard of that in some cases of providers perhaps, denying a person a vaccine. And I think it's really tough in this space, because then we kind of have missed that opportunity. Obviously, if they're not yet eligible, then we need to counsel them on that. But there are certain situations in which the person could choose to get that vaccine. And I think, again, it needs to be a discussion. But as we'll talk about here shortly, healthcare provider recommendations continue to play an incredibly important role in all vaccination space, and particularly the COVID-19 vaccination space. So we've been getting a lot of questions on that. I just wanted to kind of to touch on that. And I think that's something we'll continue to get questions about from the public. Next slide, please. So again, we really want to recommend that everyone 6 months and older stay up to date. We have a lot of room for improvement in vaccinating our pediatric population. And then now with a new Omicron bivalent booster dose, we have a lot more people who are eligible again, including myself. My hospital just started offering them yesterday. So, we've had them in the state, but certainly still have a lot of work to do in people going to get their bivalent booster. And so the side effects that we anticipate are similar to the other shots that people receive for COVID-19, that local pain, swelling, erythema at the injection site, and then those more systemic fever, fatigue, headache, chills. There have been reports of lymphadenopathy, so swollen lymph nodes, both with infection, but also with vaccination. Next slide. If there is an error, as Dr. Capehart went over, this is complicated stuff, and we as a state have worked to create some documents and resources to try to help limit those errors. If there is an error that occurs, it needs to be reported to VAERS, and then also at a state level, call our West Virginia COVID-19 hotline. Dr. Elizabeth Sharman, who coordinates that hotline, would able to give additional guidance, and it helps us track in the state issues that are occurring so that we can react more in real time than what the length it takes to get a VAERS report. Next slide. So I just want to talk about some communication resources. As Dr. Capehart kind of mentioned, we do have ongoing mixed method social science looking at people, West Virginians' intentions, perceptions, beliefs when it comes to all vaccination, but notably COVID-19 vaccination. And so if you go to the next slide, I think it's going to be important that we continue to educate ourselves. Dr. Capehart put together a just-in-time training that is available if you go to that link or use that QR code. And then tomorrow, Dr. Capehart, myself, and then Dr. Frostino, who we've mentioned, will be giving a very similar talk through the West Virginia Immunization Network from noon to 1. And there's also CME available in that session. So if you go to the next slide, here are some available resources that we have, particularly to the Omicron booster shot, available at our social press kit that I can drop into the link or into the chat later. But here you can see a link in a QR code that would take you directly there. There are posters that you could print and hang at your clinic if you want us as the state to print them. We'll do that through grant funding that we have that we can send to you to hang up in your locations. If you go to the next slide. I do want to touch on the vaccination due date calculator. So this is a first of its kind tool. We were the first in the nation to do something like this. Now there's a couple other states, and the CDC built one actually based upon ours, where we still think ours is the best because ours kind of takes into account all ages and not just eligible age groups. But if you go to vaccinate.w.gov and scroll down, you can get to the vaccination due date calculator. If you go to the next slide, this is just kind of walk you through this. This kind of gives you a disclaimer of what you would see. And this kind of helps in regards to, putting in a little bit of information, and it helps individuals know, and providers can do this for their patients when a person is due, or if they're considered to be up to date based upon the most recent CDC guidance. So if you go to the next page, next slide. Here you can see here there's a disclaimer. You're going to be asked to put in a birth date, your type and number of COVID shots, whether you're moderately severely immunocompromised, and the date of your most recent shot, including if that was a bivalent booster. So if you go to the next slide, this is where it goes. You put in your birth date first. Next slide. Then it asks, have you ever had any COVID-19 shots before? If so, how many? Next slide. It asks, like, what was your first COVID-19 shot? So you can see the options available there. Next slide. Then it asks you if you're considered to be immunocompromised or not. And there's also a list of medications that are what are considered to suppress the immune system to consider that person to be moderately to severely immunocompromised. Then you click next. And then you here would put in your most recent COVID-19 shot, and if you've had an Omicron booster shot. And so you would check that box if that's the case. Then you click finish. and go to the next slide, and you will see here that it will tell you when you get your due date type, or if you're considered to be up to date. There's also a link there that can take the person to vaccines.gov so that they could find a vaccination location near them. And then if you go to the next slide, particularly for our healthcare populations, we created a medical info page. And so if you scroll to the bottom, you can click on that. And then it takes you to a summary of clinical considerations and info links. So we've tried to streamline what we've heard from partners to be the most used information from various sources in the FDA and CDC. And we've tried to make it be more of a one-stop shop there. So if you go to the next slide, you can see here, that is that medical info page that it gives you a summary of all the input that was put in. And then it also gives you links to important resources that based upon our team, including Dr. Capehart and myself, as well as partners have shared to try to make it be as all in one place as it can be. It's certainly not an exclusive list, but it does have many of the main resources. Next slide. So if you want to embed this on your practice's website or your own, you have a website, you can do so here. And we can certainly help you with that if you email jic@wv.gov. And so if you go to the next slide, these are some of those posters I talked about. If you go to covidvaxwv.org/order, you can order those posters. We also have lanyards available, buttons, that air prevention magnet that I said, that I showed earlier. We are going to be sending also provider toolkits out to individuals who are enrolled in the COVID-19 vaccination program within the next 4 to 6 weeks. And so be on the lookout for that, in which you'll get a sampling of these items and then the opportunity to order more. Next slide. This is the links to the EUA fact sheets. It's always important, you're also supposed to give this to the person that you're administering the vaccine to, or the guardian of such. And so these are important to review as well. Next slide. And so we'll pause there for any questions. I know we went over a lot of material. I think, the important thing for us is if you're not enrolled in the COVID-19 vaccination program and you would like to give COVID-19 vaccines, certainly reach out to Dr. Capehart or myself, and we can connect you with the people that can help facilitate that. We need to expand access, and our state supply continues to increase in regards to the number of COVID-19 vaccination Omicron bivalent booster shots that we have. And so I will now turn it over to the ECHO team, and we would happily take any questions that individuals may have.
Thank you both so much, Dr. Costello and Dr. Capehart. We really appreciate your time and your expertise with the group. But yeah, we'll open it up for any questions, comments from the group, and everyone is welcome to chime in. If you prefer to chat in, I'm happy to read it out loud as well.
I guess I would have a question for the group. I mean, are people getting asked about this? I think that, we certainly, I think that there's a lot of fatigue out there. There's certainly been individuals who are, quick to accept vaccines and more that are slow. But just trying to assess, we're trying to ramp up the public and provider communication that we have, because we know that there's a lot of confusion. As Dr. Capehart said, we have data that says that people, there's actually a negative intention to get vaccinated just by using the word bivalent versus if you use the word Omicron or updated. There's just a lot of confusion that people don't know the difference. So I'd be interested to hear if people are getting asked about this, if they're seeing people, want to be vaccinated or seeking out the vaccine.
That's a great question, Dr. Costello, and we'll give it the echo pause here in case folks need to think about their answers or anything. So.
I can start. I mean, from the Echo team. My provider has not mentioned it to me. I'm not gonna lie, and I do go to the doctor fairly often. But I am inquiring because I'd like to get it, but I'm also, I think I was always afraid to ask because I'm always thinking other people need it first. And I know that's weird, but in my mind, I'm like, okay, I gotta wait till I hear that my parents have gotten it and other people, and then I'll go in and get it. So I think that resource of knowing when is excellent so that we can enter that in and really find out when we need it. So I do think that they need a, I don't know, at least on my end, feel like they should ask a little bit because I think sometimes we're hesitant. I'm not hesitant to get it, but I'm hesitant to think like, well, maybe because of my age, that's why they're not asking me yet. And maybe I don't need that other booster as of yet, personally.
No, thanks for sharing that. I think that that's a big, important reminder. Believe me, people are tired. I wholeheartedly get that. But I mean, even myself, I mean, I work in the hospital setting and, we're at the time now where we're going to start asking people about flu shots, but we still don't really routinely ask about COVID shots. When I get referrals from other people, frequently they'll say the kid is up to date on vaccines. And then I say, okay, including COVID. And they're like, oh no, we didn't ask, or oh no, no, they don't have COVID. And then they're coming in with COVID. And so, that's an important part of the history. So even in kids who are vaccine eligible that have COVID, we're not even asking them if they had the COVID vaccine. So I know that sometimes many times these conversations are tough, but as healthcare providers, the more that we ask, I like to akin it to like planting the seed. If we have this conversation, like plant the seed, somebody else over time will come along and water it and eventually it'll grow. It might take more than one conversation to have with someone to get vaccination, or they may not know that the vaccines are available there. Or your clinic may not have it, but you can direct someone to a local pharmacy who may, and they can go get vaccinated there, certainly if they're eligible. But thanks for sharing that. I don't know if anybody else has thoughts.
The last thing that I heard from West Virginia was that they were, starting with the 85 plus crowd and healthcare providers would eventually work their way down. I've not heard anything since then about that being opened up. Like, I'm not 85 plus, but I'm just curious. I would say that if there's a failure in the message of it's available to whoever the population is, it would help.
Dr. Works, that's incredibly helpful information. Dr. Capehart and I have tried to do that. I think there was confusion because of, if you go back to December 2020, that's what we did. You're exactly right. What you described, there was limited vaccine. And certainly as there's been discussion about this new booster, we've tried to strategically place it in areas to reach those higher risk populations. So like nursing homes, for example, making sure that nursing home residents, who might have a more difficult time getting access, we place vaccines there. But, like I said, I'm planning to go get my booster, this week. And so I really appreciate you sharing that, because I think, it's going to take us all to kind of relay that, it's certainly a goal to reach the more vulnerable more quickly, but at the same time, not limiting other individuals who may want to get vaccinated. I don't know, Dr. Capehart, if you have anything to add,
yeah, and I would second that. And I would also say that at this point in time, it's pretty readily available across the state. The federal government has made it a priority to have it more available in the as part of the federal pharmacy program. So for instance, we've been notified that through the end of September that the remaining Moderna is going to be allocated to the federal pharmacy programs, and that decision's been made at the federal level. But we have plenty of sufficient quantities of Pfizer and have been sending that out as entities have placed requests. But I mean, there's plenty of vaccine throughout the state. It's readily available, and so I would encourage, definitely anybody who is due for a vaccine to go get that. We did the initial placement based off of those priorities, but once the vaccine got here, absolutely, we encourage everyone to go get it who's eligible.
Yes, thank you for sharing that, because that was a concern of ours, that was going to be the message that was received, and it seems like it has been, and that's obviously not the main message that we want to get across. So thank you.
Yeah, I haven't heard anything state specific, and even up through like a podcast from the end of last week, the NPR is that's still what they're saying. So in addition to having to wait my turn after my summer booster, it's still, I said, I don't, at being altruistic, I don't want to steal it from somebody that really, really needs it. And so if it's really available and everybody can go get it, it would, since the governor's still doing his thrice weekly COVID press conferences, you might see if you can get him to mention that it's readily available now.
Yeah, absolutely. And we continued our pandemic leadership, retired General Jim Hoyer, who leads our joint interagency task force, Dr. Marsh, Dr. Amjad, our current state health officer. So yeah, we'll, I think, kind of maybe provide more clarity on that. So thank you for sharing that.
Thank you for that question, Dr. Wurntz. Any other questions, comments from the group? And as always, you're welcome to email both Elizabeth and myself if you do think of questions after the fact, and we'll send them along to Dr. Costello and Capehart. Any final comments before I go into announcements?
I just want to say thanks so much for having me, everyone. I appreciated it and enjoyed it. And I've got to jump back into a legislative meeting, but you guys have a wonderful afternoon.
Absolutely. Thank you so much, Dr. Capehart. We really appreciate you. All right. Well, the only announcement that I have is that just a reminder that these sessions are now a pop-up style. So we encourage you all to reach out with any topic requests that you have, any questions along the way, and we'll be sure to find a speaker for the topic requests and everything, and try to hold the sessions as soon as possible when those are submitted. They'll always fall on the third Thursday of each month, 12:15 to 1:15 if we do have pop-ups. So again, thank you so much, Dr. Costello, Dr. Capehart as well, who had to hop off here, and your adorable 7-month-old. We're so happy to have her on the call too.
Yes, she was well behaved. She was fascinated with your questions too, and she is so excited for ECHO. But thank you to the Project ECHO team, and please reach out with any questions.
Absolutely, and we'll always attach your PowerPoint slides in the recap email, so everyone will have all those great resources as well. So thank you all so much, and we look forward to seeing you all next time. Take care.